I want to introduce our next speaker, Dr. Joe Palmer, to my left. Practicing dentist in South Carolina since graduating from South Carolina School of Dentistry in 1982. He's been a member since 2001. He received his fellowship and is our current treasurer of the Academy and doing a great job, by the way. And many more accolades, but let's get started. Joe Palmer.
I'd like to give you a little bit more background on why I'm doing this, what my history's been with being a dentist with occupational exposure to mercury. So I got out in '83, started practicing dentistry. My wife was my assistant. We didn't have any patients. You know, we just piddled along and saw a couple a day for a while. So since we weren't doing any dentistry, she managed to get pregnant. And couple months later, my wife had a miscarriage. Didn't connect the two at the time, but I connected now. And then she later on kept working chairside. She only worked about 6 months chairside. And 2 years later, she started getting all these symptoms, chronic pain, fatigue, all the typical symptoms. And the typical allopathic physician said, oh, you just got fibromyalgia, which they don't know what the hell that is or what it's caused from. They just lump a bunch of symptoms into fibromyalgia. And I said, no, that doesn't jive with me because they don't know what they're talking about. They can't tell you what's causing it. And I sent her to a guy that was helping me do some TMJ, pain specialist. He was an MD, an internist. He came back and said, no, you've got heavy metal poisoning. That was my, of course, I was a stupid jerk from dental school and just out really didn't know a thing about mercury and believed everything the dental schools had taught me. Didn't even connect. Where'd you get mercury poisoning? Because she had arsenic and other things that go along with it. And so she got cleared up. She went through chelation, was doing better. She didn't work at the office anymore. She stayed healthy since. Me, I thought I was just a Superman, and I just kept practicing dentistry, putting amalgams in, taking them out, no protection at all, because I didn't know. Nobody told me to do that. Everybody said it was safe. So it didn't take long for me to get grumpy, or start having arthritic type pains, depression. You didn't want to work for me. I wasn't thinking about killing me, but I would kill you in a heartbeat. I mean, it was really that bad. I wanted to quit dentistry. I wanted to go back to oral surgery school, so I just see the patients take their wisdom tooth out and get them out of my life. You know, everything irritated me. And finally, my smart wife said, you know, Joe, you probably have mercury poisoning. I got it from working in there. Don't you think you're getting it? So I said, okay. So I went and got checked. My numbers were off the chart. So I got chelated, got those numbers down, didn't have a clue how to prevent it. Hadn't met the IAOMT yet. And so I kept practicing for another couple of years, but I'd stopped putting them in, didn't believe in them anymore, but I was still taking them out. Finally, I met Bill Virtue through a practice management consultant that we both mutually used, and became friends with Bill. He kept telling me to come to an IAOMT meeting. I didn't come because I was teaching CEREC for Patterson Dental, did that for 10 years, and every time we had a meeting, I'd rather go make money teaching. And so that resulted in my first heart attack. And so finally, I got smart. I came to this meeting, talked by Rich Channon, opened my eyes, started doing things. Had to get chelated again because I recontaminated myself. And, hey, Dave. And started doing what this academy taught me to do. I don't have any power. I'm losing the battery. Maybe somebody unplugged. Oh, never mind. Somebody unplugged it. I got it. All right, we're good. Probably Bill. You're probably right. I'll blame it on him anyway. So to kind of summarize what Bill did, that, mercury is a neurotoxin and any exposure is dangerous. I don't care what the levels are, any exposure is dangerous. The toxic effects can act on each individual based upon their genotype and how much exposure they have, and where maybe something else the weak systems are of the body. And one or a combination of symptoms can be present, and they can change over time. Coexisting factors influence this kind of personalized reaction that we have. And it can take many years for symptoms to manifest themselves. My first heart attack actually occurred after I'd started doing my complete protection. It just took a while to happen. And you saw in Paranandi studies from Ohio State, we know that heavy metals damage the heart, the endothelial line of the vessels. And you'll see all these biological dental terms that are out there that dentists are using today. A lot of dentists say they're mercury-free, meaning they do not place mercury amalgam fillings. Thank goodness, I'm glad they're not. But they're not necessarily mercury safe, and use rigorous safety measures to prevent your exposure and your patient's exposure. And the reason we have developed even more protective for you and the patient barriers, one reason is because my levels went up again, and I said, we got to do something better. And so a bunch of us got together, and we did this little study I'll talk about in a little bit. And now I think we've got the best safety measures we can currently to prevent you and your patients from being exposed to mercury as you have to take it out. You'll see also biological or biocompatible mercury-free, mercury-safe, and all these different terms. But basically it means to be a biological dentist, you're going to know the impact of the dental materials you use when you restore teeth. So we don't really know how many dentists practice mercury-free. You know, we're saying 50% don't put it in. I say that there are no mercury-free dentists because we all have to deal with redoing these restorations. And every time you take one out, you're exposing everybody to mercury. And the two forms of mercury exposure to your dental teams, they can't really be separated, but it's mercury vapor. And that's the one we kind of knew about at first. And we knew that you can inhale this mercury vapor, and we've known it for years. I'll show you studies that go way back. We know that you get 80% of it into your body when you inhale it. And within approximately 10 minutes of absorption, about 30% of the mercury in the lung is transferred to the blood. Inhalation of large amounts can damage the lower parts of the bronchial tree and lung tissue. That would be like an acute mercury poisoning case. And let's see, I might put my glasses on. Make sure I can read this red print. There we go. So this is kind of a more recent study done in 2015. It was done in Monostar City by some neuropsychological effects of mercury exposures, what they were looking for. So they want to see how many people, dentists were crazy, I guess. And so in the exposed group that they studied, scores of neurological symptoms, memory disturbances, and anxiety were significantly higher than controls. HAD depressions mean scores were higher in the exposed group than in controls, and most of the neurotoxic manifestations were correlated to the levels of urinary mercury excretion in the exposed group. These were dentists. The conclusion was that increased levels of urinary mercury observed in dentists suggest that prevention should be strengthened with a special medical supervision program of dentists exposed to mercury vapors. And you're going to see this continuing theme in studies done on dentists. But the ADA says we're practicing perfectly safe. This was in the Journal of Scientific Environmental Epidemiology. And this is more recent one too. This is 2016. There's two forms of mercury we're exposed to: methylmercury from fish consumption, elemental mercury from dental amalgam restorations. And Bill went over some charts on that. So this study was done on 630 dental professionals from an American Dental Association meeting to assess mercury body burden and primary source of exposure in the dually exposed populations. And they found that the participants, the dentists, were higher than the general U.S. population. Personal amalgams predicted urine mercury levels, along with total years in dentistry. Amalgams handled working hours and sex between male and females. Males tend to keep mercury more than females usually. And then in another study of dentists done by the ADA, and this time they did a DMSA challenge, so they chelated some mercury out. And they did this on 4,272 U.S. dentists. That's a lot of dentists. This is a big test sample. Their mean urine level from the DMSA, the mean was 14.2. That's high. You want it, when you're going through chelation and you're trying to get your levels down, your goal is to get it below 3. 19.1% were over 20. 10.9% were over the CDC maximum, accepted level of 30. And that's not even in urine, that's really exposure in air when you're working. 4.9% were over 50, the level found to induce tremors. When I was tested, mine were 85. The first doctor who treated me said I was the highest he had ever seen. And the second doctor who treated me said I was the second highest. And 1.3% were over 100, the level found to cause tremors. But the ADA keeps telling us it's safe, what we're doing. Don't understand why they do that. That's their study.
In 1991, the World Health Organization acknowledged that the predominant source of human exposure to mercury is from your fillings. That should be of concern to anyone. So all mercury-silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations. They're at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum. The dentist might send an old gold crown to the dental lab to be welded. How about the dental personnel? They're not being given informed consent. Back in 1985, the International Academy of Oral Medicine and Toxicology set out to determine the amount of mercury that was coming off fillings. And here's the graph, showing substantial quantities of mercury were measured coming off fillings. And then we estimated the total dose.
Yeah, y'all seen those slides and you've seen that study in Bill's stuff. These slides, by the way, are on your app. And to get to them, you go to all the slides this weekend will be on the app. And you go to, it's a speaker turned them in. So you go to the speaker's name, click on the speaker list, click on the speaker's name, scroll down, and you'll be able to open these slides up if you want to do that. I don't know if the movies play or not, but I know the slides are there. So we're also exposed to particulate. That's part of our exposure. In Richardson's risk assessment study done in 2010, he took in the fact that we were exposed to the mercury vapor and the things that produce when we do mercury. We also have a concurrent exposure to lead, methyl mercury, and elemental mercury in the U.S. population. And a large proportion of the U.S. population is concurrently exposed to all of these on a daily basis. So we've not only got our occupational exposure, we've just got our normal environmental exposure from living with everybody else. In 2011, Dr. Richardson reported that more than 67 million Americans aged 2 years and older exceed the intake of mercury vapor considered safe by the U.S. EPA due to their dental mercury amalgam fillings, and 122 million Americans exceed the intake of mercury vapor considered safe by the California EPA, which is lower. None of it's safe. And how about inhalation of mercury-contaminated particles by dentists? And this is an overlooked occupational risk, or it was at the time Mark came up with a study. So he wrote this article in assessing the occupational risk from mercury particulates, and he states, it is apparent that the single largest source of mercury exposure to the practicing dentist is the removal of old amalgam fillings. The dose of mercury contained in the amalgam particulate inhaled with the removal of just such a single small filling far exceeds that associated with the inhalation of mercury vapor contained within the general dental operatory air over the course of the entire week. So what happens when we absorb vapor is we exhale it, and we get about 80% of that. But in that vapor is a particulate. It can't not be separated. And when you absorb the particulate, it can lodge in your lungs and stay there. And Bill showed the half-life of mercury is very long. It can literally stay there with you the rest of your life.
I researched all the literature on the occupational exposure of dentists to amalgam and ended up writing a paper as a result of that research that was published on exposure predominantly to particulate matter. As dentists drill out a filling, their dental drill runs at about 400,000 RPM, and it sends a shower of micron size and submicron size particles everywhere. It's tens of thousands of parts per million. There was literature actually that measured the amount of particulate matter in the airspace or the breathing zone of a dentist during removals, and a researcher had studied this using mannequins into which they had put in fake teeth with fillings in them and then drilled them out and taken all the measurements while they were doing it. And the dose of particulate matter experienced by dentists, if they don't take precautions, is huge. It's way larger than the vapor exposure they get during the same process. Particulate exposure for a single filling delivers micrograms of mercury, which in mercury terms is a lot. And this happens, at the time, the average was around 4 to 5 fillings were removed by a typical dentist in a given day so that he could replace them or whatever. And even if they wear the typical surgical mask, they're designed to stop particles of around 3 microns in size or larger, because that's the size of typical bacteria. Well, the particles of amalgam pass right through that mask because they're well less than 3 microns. They average around 1.5 microns in size and go down to the submicron level. The amalgam load would probably give them 100 times more exposure to mercury than just inhaling the vapor that is present at the same time. The particle load carries 50% of the mass of any particular particle is mercury. And that's delivered straight to the lungs, and it's absorbed within 3 days, and the mass is quite large. And it stays there, as opposed to the mercury vapor drops off fairly quickly. The amalgam particles that have been inhaled, they don't dissipate anywhere but directly into the body. So the dose delivered is very, very significant.
So I'm going to be showing y'all some fairly strict protocols. You got a little hint of them there in that film. You saw Dr. Young and I all dressed up in spacesuits when we were doing a study on particulate. You heard Mark say it goes right through those little cloth masks used for AIDS and colds and bacteria because it's so small a particle. So the risk to the patient and you during amalgam removal is primarily due to what's coming off the drill, what's being stirred up, what's floating around in the air, and it's vapor and it's particulate. And the particulate is, like I said, very dangerous to stick around. So our real everyday risk routinely exceeds 100 micrograms as you're doing this of mercury in the air. And that's a dangerous level, way above any of the established allowable levels by all these government organizations. And it's in our immediate breathing zone, and it's even closer to the patient as you stir all this stuff up. So how are we going to minimize that risk? That's what we're talking about today. Chemical forms of mercury in human hair. This is kind of a study I wanted to throw in here that we just got. Where are those glasses? Because I can't read it. I don't remember what year this one was. I think this was a fairly old one, actually. So you can tell what kind of mercury you're contaminated with from hair analysis. And this study was actually part of the one that slide I didn't mean to leave in Bill's, but brought it down. This is an old study done in the 70s. And it was done to try to make mercury look good. And so what they found out when they were doing this study, as they were putting mercury amalgams in, they saw a mercury spike located by X-ray nanofluorescence. One hair strand could even be dated to removal of a single dental amalgam. But they saw when they put it in, then they would measure hair, the increase would go up in hair. So they were exposing people when they were putting the mercury in. American Industrial Hygiene Association journal back in 1972, they looked at the work environment and procedures of 23 dentists and their assistants were surveyed by the existence of potential health hazards which could be associated with the preparation of mercury amalgam fillings. They collected, what was happening in the work environment, looked at the ventilation that was going on, the individual procedures, hazard awareness, what kind they had, the process that they were doing it, as well as the removal of old fillings and putting in new fillings. The results indicated that the greatest potential hazard may result from contamination of hands after working with mercury metal or fresh amalgam. People were mixing mercury back then still, squeeze cloths and everything. But the respirable dust in terms of total concentration of mercury content was also significant. This study also demonstrated the almost complete unawareness of most dental assistants and of many dentists that mercury could be hazardous. Consequently, precautionary measures were almost non-existent. And I'm pretty sure this study actually recommended, well, make sure you wash your hands when you've been working with mercury before you have a cigarette. That's how old it was back in the 70s. Other studies have established that dentists and their team members are exposed to mercury vapor and mercury particulate. Hirsch and Goldsmith in 1989 showed mercury vapor is absorbed through the skin, pretty high concentrations, but it will go through the skin. Within 27 to 43 minutes of exposure, then that led to blood levels of 216 to 844 micrograms of mercury. So you're not working, we're all working with gloves now. But you take your gloves off, and maybe you take some instruments out and you don't have your gloves on. Or the particulate that you've just done on your unprotected skin or your arms, you're getting particulate on your skin. I know you wash it off. Maybe you don't wash up your elbows. You do that a couple times a day, you have particulate all over your body. And it's on your clothes, and I'll show you that later. It gets on your clothes and stays there. You can be exposed all day. Now, Nemo, this is a great study that Nemo did. He did particulate inhalation during the removal of amalgam restorations. It was published in the Journal of Prosthetic Dentistry in 1990. And he showed the use of water spray, high-velocity evacuation, and a rubber dam almost completely eliminated particulate inhalation by the patient, almost. The simulation of the dentist was exposed to moderate amounts of fully respirable particles for all conditions tested. So we've known, published since the 70s, that dentists have higher exposures or occupational exposure, and nobody's done anything about it. Systemic mercury levels caused by inhaling mist during high-speed amalgam grinding, this was done by Cutright, and this was done on rats. The inhaled dust was immediately absorbed into the bloodstream. The heart received extremely high levels of mercury within minutes, 81 times the control, and the brain and liver reached their highest levels of exposure within 16 hours, 7 times the control. The kidney levels rise slowly and remained high at 72 hours. So we know it gets in, it goes in the body, it attacks our organs. My heart loves the stuff, attack my heart. So this is a study sponsored by the IAOMT that we looked at how good our protective measures were. We wanted to see what was happening. And it was done by myself, Matt Young, Bill Virtue, David Warwick, and we had industrial hygienists in, taking the samples. We had people running our mercury analyzer, the vapor analyzers, so we tested for particulate. Surfaces in the operatory, surfaces on people that were involved, and wanted to see what we do. So we started off with all our controls on, and that means our suction units, and our cleanups. We had rubber dam on, and we set it up just like we'd be doing it, and we'd take off a lever measure and see what would happen. Every time we took off one of our engineering controls designed to limit exposure, the exposure levels would go up. So we came up, this is just a little summary of some results. Not all, we got tons of data, but unfortunately the people who want us to publish want us to have more data. So we had all our controls were on. And in particulate and vapor on the assistant, she was getting exposed to 3.3 micrograms of vapor we were testing the assistant's knee, thigh, right in, right closest to the mouth as she was, or actually I was assistant as I was sitting there. The peak vapor exposure was like 1.3 micrograms, and the average of the total vapor, I mean, if you're just looking at peak, the peak was 1.3. But if you looked at the total, it was 160.5 we were exposed to. So the highest particulate samples were on the assistant's knee at 2.9 micrograms, and on the patient's chest, on the napkin, 340 micrograms on the patient. And that's with all our controls on. So then we looked at the way, I'm just putting the way most dentists do it now, the way you may be doing it now, just using water and dental suction, like the ADA tells us to use it. And we saw the particulate and vapor exposure to the assistant went up to 5.3. The peaks went up, 21.4. The total vapor was 2,901 micrograms over how long it took. We were taking out 4 fillings, 4 occlusal fillings. 360 micrograms of particulate went on the assistant's leg. Would stay there all day if she just had her scrubs on or whatever. 1,900 micrograms on the patient's chest. So you got a patient that's not protected, not doing the minimum controls like the AD tells us to, or even with our controls on. She's got exposure, if it's a female, all on her blouse. Goes, picks up her kid at daycare. What's the kid going to do? Jump up and hug mommy, right? Now the kid's exposed. So we wanted to do something to stop that. So remember this, as I go under these controls and what we're doing now, with all these in place, you are still exposed to mercury vapor and particulate. That's why we're going to look at using disposable barriers, so you won't just accumulate all day. Remember, it's inhaled. It's absorbed through the skin. You don't want it to get on your skin or your clothing, and that's our goal now. So Robin Warwick, one of our members, David's daughter back there, if you don't know Dave, back there running our audio-visual stuff. He might look like a guy just bumming around. He's one of the smartest guys. He's probably the smartest guy in the room right now. He'll be the second smartest after David Kennedy walks in. So maybe the smartest. He's a lot smarter than me, I can tell you that. So this is David's daughter. And she did a study while they were in dental school. She wanted to see what the dental students' exposure was in their lab. So she measured the mercury vapor while removing mercury fillings in the dental school lab. She measured levels of water and suction only, cutting high and dry, which they did in there. So the water and suction we used levels were below the threshold of 25 micrograms for an 8-hour period set by Alberta Occupational Health. Y'all want to be exposed to 25 micrograms? With suction only or cutting dry, levels exceeded threshold by 8% and 36% respectively. They went up. Now, Robin got this published. And a notable quote from that publication is, "It is paramount that dental schools consider how dental students are trained in the subject of mercury hygiene when removing dental amalgam as well as other procedures where mercury exposure may occur. They must also train dental students in the effective use of personal protective equipment in order to prevent occupational exposure to mercury while in dental school and in clinical practice." The IAOMT is currently in discussion with the University of Indiana. Preliminary, but they've offered a meeting where we are going to offer money in a matching grant program to at least equip a room where mercury can be removed safely for these students. So that's where we're working with dental students. If we can get one school to do that, we hope it would tip, and the schools will start teaching other things. So support that with your current memberships and participation in this organization. That's some of the things we're doing. The World Health Organization has stated studies suggest that mercury may have no threshold below which some adverse effects do not occur. So the most stringent government organizations that have published thresholds is the Agency for Toxic Substances and Disease Registry, and the EPA kind of came together to determine what the lowest observed adverse effect level should be. And basically, they define a minimal risk level for chronic exposures to mercury of 0.2 micrograms per meter cube. And when they did this, they saw that the workplace average was adjusted. Well, they did it from workplace, but they picked it up and they put all these different workers together into a program, and they actually determined where tremor started in this study, which was at 26 micrograms. But then they have severely lowered it. And then you get all these other numbers that come basically from industries that use mercury in their processes of production. And the way they get these numbers for those industries or those levels is that's as low as they can get it. So say they're making bleach and the level's 100, but what they do in that industry is, one, they're not in that room walking around in their shirt sleeves and no mask or no kind of respirator mask on. They're in there protected. But if the level gets to 50, they shut the production line down so they can get the levels back down. So they don't even let it exceed those levels. And they are working protected. We as dentists are working every day, no protection at all, unless you're an IAOMT dentist and you know what to do, or some of the organizations. So that we know with what we do that our mercury vapor exceeds all levels, that with 6 mercury fillings in the mouth, we know it's 2 times those levels, 400 times the EPA's. Opening a mixed amalgam capsule, huge exposure. If you open the jar it comes in, the minute you open it, we measured like 450 micrograms just in the jar of capsules, but the capsules weren't even open. So all the things we do in the office exceed these levels. And you look at these numbers. There's amalgam capsule, just titrating it, when you open it up, 400 micrograms. When you're cleaning out your chairside traps, you can be exposed to like 600 micrograms. Drilling with no water spray, 1,200. Drilling with water, you can get 100 to 460 micrograms. Drilling with water and suction, it comes down, but it's still high, 15 to 40. Polishing, doing a prophy. You may create 500 to almost 1,000 micrograms. So what do? My hygienists wear a mask. And I tell them don't polish them. Stay away from them. But if they got a mercury in their mouth, put a mask on when you polish. A respiratory mask, not just a cloth mask. Protective mask. Most of my patients are smart enough to know, wait a minute, if you got to do that, maybe I should get them out of my mouth. Some of them aren't, but most of them are. Dr. Duplinsky, who might be here this weekend, I don't know if he's coming, he's a member of our academy, He published in the Internal Journal of Statistics and Medical Research, it would seem prudent to advise that dentists consider using restorations that do not contain mercury, because he found in the dentist population, we take more drugs for mental health issues, we have more disease and take more prescription drugs than the general population does. Here's some other studies that show occupational mercury research. Carousel in 2010, all found higher, and all these studies lumped together, all found higher levels of mercury in dental workers. Dentists had increased skin hyperpigmentation, respiratory disorders, irregular pulse, hand tremors, spasms of the upper extremities, neuropsychological problems, tachycardias, painful chewing, that's funny, thyroid enlargement, fears and difficulty in writing. Muttered neurological issues such as memory loss, concentration issues, fatigue, and sleep disturbances. Lindborn, increased risk of miscarriage. Ritchie, I've since have 2 great children since then, so been blessed by that. Ritchie, renal and memory issues. Langworth, increased CNS symptoms. Rowland, assistants working had lower fertility. All these in dental workers. You're supposed to be telling them this. You know, we're supposed to train our workers. We have to put a radiation badge on them in South Carolina. We don't have to do anything about mercury. And it's probably not, OSHA's probably not coming to your office. I'm not trying to scare you. But ethically, once you know this information, I will hope you will take measures to protect your employees and train them how to protect themselves. And those that don't want to do that, tell them to find another career choice in somebody else's office. So, association between history of dental amalgam fillings and risk of Parkinson's disease. So this study linked those two together. And it was done over in Taiwan. They say it's still uncertain, although positive association between dental amalgam and Parkinson's disease has been found in a few case-control studies. The patients with amalgam fillings restored between 2000 and 2008 were identified by using their National Health Insurance Research Database. The same number of patients who had no new amalgam filling restoration was matched by sex, age, and treatment, so they looked at 2 populations, one with fillings, one without. And they found that these patients exposed to dental amalgam fillings were 1.583 times more likely to have Parkinson's disease afterward compared to their non-exposed counterparts. So what's our ADA recommendations? And it hasn't changed much. And this was out of a journal in 1976. And the whole journal was dedicated to occupational exposure to mercury. It has great articles in it. They had an office that was contaminated by a disgruntled office worker. She spread mercury everywhere. They had to clean that up. They had a father and son who practiced together. Both of them severely mercury toxic and had to be treated. Went in their office. It was covered up with vapor and exposure problems. A couple other articles, and what they came up with was what they recommend today. This was a time when mercury was still being used in squeeze cloths and coming over to being encapsulated. They thought encapsulating it would take care of it. You have to store it in unbreakable, tightly sealed containers. So you're not supposed to take the capsules, fill up a little pink cup, keep them there, and keep taking them out and doing it. They're supposed to be sealed up. Perform all operations involving mercury over areas that have impervious and suitably lipped surfaces so as to find and can facilitate recovery of spilled mercury or amalgam. Clean it up immediately. Droplets may be picked up with narrow bore tubing connected via wash bottle trap to the low volume aspirator of the dental unit, but you're not supposed to vacuum it with a vacuum cleaner. Use tightly closed capsules during amalgamation. Make sure they're closed. Use a no-touch technique. Salvage all the scrap and store it underwater. Working well ventilated spaces. Avoid carpeting in your operatories as decontamination is not possible. Eliminate the use of mercury-containing solutions. Avoid heating mercury or amalgam. Use water spray and suction when grinding dental amalgam. Use conventional dental amalgam compacting procedures, but do not use ultrasonic amalgam condensers. Perform yearly mercury determinations on all personnel regularly employed in dental offices. Has anybody ever done that for their employees? I'd be scared to. Have periodic mercury vapor level determinations made in operatories. You can do that if you like. We have a program that you can use a drone and rent one from the academy, and you can check what your levels are in your office. Alert all personnel involved in handling the mercury, especially during training or indoctrination periods, of the potential hazard of mercury vapor and the necessity for observing good mercury hygiene practices. And these are in the ADA's best practice management on their website. This was published in that journal. So keep doing what you're doing, and you're supposed to be safe, but you're not. In this spill kit, you're supposed to have all.
Well, I start to feel like Superman, and I pick a fight. Find that my opponent holding kryptonite. You think I've learned my lesson, but I'm still paying dues. Each time I drink and start to think I'm 10 feet tall and bulletproof.
So, that's my history of mercury. 2 heart attacks. 2 times I have to go through chelation, which cost a ton of money. Second time, I'd only gotten up to 45 micrograms. Now, you remember, and we don't know, I was doing, after the first chelation, I had found IAOMT, and I started doing some of the protection protocols that I'm showing you today, but just some of them. You know, I was using a mask. I had one in there back in the office at that time, but probably not at first. I kind of added that in slow. But somehow or another, my levels went back up. Now, maybe they never got all the way down, because I had a ton of it in me. But I know for a fact, because of my lifestyle, that my heart trouble has come from mercury poisoning, and that's where it's come from. Could have been from all the hell I raised in college too, but I kind of doubt it. So, this is what the Academy is teaching today. And we've labeled it Smart, Safe Mercury Amalgam Removal Technique. It's designed based on science to be the best level of protection we can recommend for your assistant, for your patient, and for the dentist. Come on, Griffin.
These silver amalgam fillings in our mouths are made out of poisonous mercury, which is highly toxic.
So toxic that the United States signed on to a United Nations global treaty with over 100 other countries to protect human health and the environment from the adverse effects of mercury.
That mercury in our mouths, that mercury in our silver fillings.
Well, it's been proven that those amalgam fillings release mercury into our mouths 24 hours per day.
And getting them taken out can also cause even more dangerous levels of mercury exposure. So that's why it's important to have them removed safely. Make the smart choice to protect your health by watching the following videos and educating yourself about the safe mercury amalgam removal technique, or SMART, from the International Academy of Oral Medicine and Toxicology at www.thesmartchoice.com.
All right, so there's two prongs of SMART that the Academy is using. We're trying to educate patients coming into dental offices that they need to be protected. Honestly, we got tired of trying to educate dentists. We welcome all the new, how many new people? Who's first time hearing this? And are y'all members? How many of you are members? So we got a lot of non-members in here. Good. We welcome you. I'm not saying we don't want dentists to learn, because we do want dentists to learn. But as we focus everything trying to get dentists to learn, or talking to them at meetings, they just thought we were a bunch of quacks. We've suddenly become the quacks, when originally they were the quacks. So it's really hard to talk to a dentist that's been practicing for 30, 40 years like I have, with the ADA telling him he's doing everything right, and he thinks he's doing everything right, and I commend him because I know he's a good guy, but he just won't listen. He just won't listen to new science. You don't hear this kind of science at a dental meeting. You're hearing it here. And everything I promise you that we base this on is based on science, good science. So we want to increase the demand for you. That's part of SMART.
I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. This is a demonstration about the unsafe levels of mercury that are released when a dentist drills out a mercury amalgam filling from your tooth, and how the safe mercury amalgam removal technique, or SMART, can protect you. In this segment, a dental mannequin was used for safety purposes because without all of the essential components of SMART, the levels of mercury exceed government safety limits. In this segment, on a real human patient, all components of SMART are in place, and levels of mercury are kept below government safety limits. As you saw, using SMART protects the patient, the dentist, the dental staff, and anyone else in the room from unsafe levels of mercury. Make the SMART choice about protecting your health by having your dental mercury fillings safely removed. Find out more about the safe mercury amalgam removal technique, including how to find a dentist certified in SMART, at thesmartchoice.com.
So we have a SMART website. These are available on YouTube. People are seeing these things, and it's starting to have an effect. So let's break it down and see what this SMART's all about. And we know who needs protection. Everybody in the room. Patient, the assistants, the team members, the dentist, everybody that's in there. I wanted to show you, this is a new instruction sheet from dispersal alloy. And I'm probably have to just kind of read some of it. I don't know how good. I couldn't make it in the slide. I tried hard, but I really couldn't. But I found this real interesting from the one we had up earlier that didn't go into any of this. This is their instruction sheet, directions for use. You know, they go through a bunch of BS on the left about its effective restoration material and all this other system. The developing neurological systems in fetuses and young children may be more sensitive to the neurotoxic effects of mercury vapor. Very limited to no clinical information is available regarding long-term health outcomes in pregnant women and developing fetuses and children under the age of 6, including infants who are breastfed. Are you kidding me? There's tons of information out there on that. There's tons of studies. You've only seen a tip of what we've shown you today. The ATSDR and Environmental Protection Agency have established levels of exposure from mercury vapor that are intended to be highly protective against health effects. And you'll notice breastfed, whatever it says. But it doesn't list them because they know they exceed that 0.2. FDA has found that scientific studies using the most reliable methods have shown that dental amalgam exposure to adults in amounts of elemental mercury below are approximately equivalent to the protective levels of exposure identified. It's not true. All right, so anyway, they cover their tails over there with current kind of science that the FDA looks at and what the ADA looks at. And then they go over here to general safety notes, and they say it is required by California to do this. Tell them they contain mercury, avoid skin contact, avoid eye contact, avoid ingestion, avoid inhalation, as this product may be harmful if vapors are inhaled. Use with adequate ventilation whenever possible. The use of protective barriers such as rubber dam isolation, high volume evacuation, and protective mask during placement and removal is recommended. Give oxygen or artificial respiration if necessary. That's what we're doing. In their instructions, they tell us to do that, although it's perfectly healthy to do that. Precautions. Wear suitable protective eyewear, clothing, mask, and gloves. Protective eyewear and, whenever possible, barrier techniques, such as rubber dam, is recommended for the patients. Regulations for disposal must be observed. All the spillage stuff. Adverse reactions. Inhalation of vapors may cause varying degrees of damage to the affected tissues and also increase susceptibility to respiratory illness. Products may cause neurotoxic, nephrotoxic, or other serious health effects if inhaled or ingested. It's all in their sheet. So, universal precautions were for AIDS. You know, back in, let's say I was in dental school in 83, so about 86 or 4 or 5, I guess 85. When we started clinic in dental school, there wasn't a box of gloves to be seen. And then the AIDS came along, the guy down in Florida infected a bunch of people. We had to wear gloves. So we started wearing gloves back in the late 80s, early 80s. This is no protection for mercury. That mask does not protect you from mercury. So let's look at what we got to do for patients. You can pre-rinse your patients with a slurry of charcoal, chlorella, or N-acetylcysteine and vitamin C, and have them swallow it beforehand. You can use a Quicksilver Scientific IMD protocol, is also a good product. You want to do full body barrier protection, including head and face protection for your patients. You want a nasal air supply for patient, either oxygen or at least compressed air. You want to use a vinyl dam and nitrile gloves and coat the dam with a HGX hand cream that will help trap the particulate and make the vinyl material even less impermeable to vapor. You're going to put a saliva ejector underneath that dam, eye protection for the patient. Come on. We have some unique suction devices. We have one called the Cleanup, and we're evaluating another one that might even be even better. And I don't remember what it's called because I just saw it last night. Auxiliary suctions with mercury air filtration you want to have in the room. You want to use copious amounts of water to reduce heat in a conventional high-speed suction in the mouth. Section the mercury fillings into large pieces as possible. And then you want to do a post-rinse with a slurry of charcoal and chlorella or then acetylcysteine and vitamin C, and don't let them swallow it. Make sure you suction it out or spit it out. So let's look at the patient barrier protection. You should only see the teeth. Whatever material you're going to use, you just want to see the teeth. I use a hood. This is one of my patients in a Tyvek drape. There's no perfect material. A vinyl-backed surgical gown has been, I think, the best material we've found for vapor. These are designed to keep particulate from going through. They're a little more permeable because they breathe. You're going to use a vinyl dam, well-isolated teeth. This is the Cleanup suction device. And if you look back under the vinyl dam where there's a suction, auxiliary suction going in there somewhere. You can't see it very well. We're using a nasal air source. I just use my nitrous machine and just use the oxygen from the nitrogen. So some of them are getting nitrous, but depending on the patient. Here's a Mercury X cream to decrease permeability of the dam to the mercury vapor, and it also helps trap those particles. They hit that dam and grab them. Now, people will go, well, some stuff's going to get under that dam. Yeah, but a lot less than if you don't use the dam. And that's why we want to get that thing off as soon as we get all the mercury out of the mouth or in the quadrant we're doing. You want to take all this stuff off. You want to dispose of it properly. The rubber dam material is really contaminated. It goes in that bucket that's going to get recycled. all the other drapes and stuff, we get them out of the office. We get them out to the trash. And then you're ready to go back in and put your restoration back in. And I didn't say one thing. Maybe I haven't seen it. You want to cover up your instruments in the back. I think I got a slide on that later. So what are these engineering controls that we do? These are the devices we can buy, machinery that we can buy to help us hold down our exposure, is what an engineering control basically is. You want to make sure that that your suction, your big suction machine in your equipment room, make sure that thing has it vented outside. It has to have a vent, but if you're venting right back into that equipment room, now you're picking up all the mercury vapor coming out of that thing, and you're recirculating it with your air conditioning system. So make sure it's vented outside. You want to use an auxiliary suction machine. There's one called IQ Air. There's one called Air Vac. These guys might be here at the meeting this weekend you can talk to. These are very, very important to have. There's a piece of equipment you need to buy first, is this. This is just more stuff on the IQ. The IQ and cost more, it has more whistles and bells. They both work fine. No mercury comes out the back end of them. You want to use nitrile gloves rather than latex gloves because it's less permeable to mercury vapor. You can use this hand cream. It's made to clean your hands. We use it on the dam, and you also can use it as a barrier on your hands and on your arms. Some Mercon wipes these are wipes containing some kind of sulfur product. We wipe the surface of the operatory down with these. Any instruments that go straight to sterilization. The handpiece in the office, we'll wipe it down after we get the mercury out, and it helps contain that mercury vapor. There's a spray. I'll spray anything in instruments, get sprayed. They go back to before they go into ultrasonic. You can put some of this stuff in the ultrasonic, and it lowers the mercury vapor coming out of your ultrasonic when you put contaminated instruments in there, because they are contaminated. These come from Ross Healthcare in Canada, and I think in the States we get them from Granger and Uline. And they make all kind of different products. They have trays you can use, wipes, containers. And in the States we get them from Granger. Good product. I don't know why my computer's being so slow, like I'm Bill or something. So how much is all this stuff going to cost? Per patient? Probably it's going to range between, just for the disposables you're going to use, about $25. That's what that extra is going to cost you. It's also going to cost a little extra time, because you got to put it on the patient. You got to stop the procedure, take the rubber dam off, throw all that stuff out, get it out of the operatory. They got to rinse, so maybe it's going to take you another 10 minutes. So you got to charge for that, guys. Don't give it away. Dr. Young charges $300-something bucks. I think I'm right at $200 now for mine, so charge for it. Or build it in your fees. However you want to do it, just don't give it away. Yeah, every time they suit up, somebody's got to pay for it. It's not going to be me. This is another engineering control that's available. It's called Attack Air. And basically this part on the left-hand side sits behind the patient. The part on the right there is in the wall, and it sets up a flow of ions that grab mercury particles and vapor and takes it over and sticks them to that plate. That's what it's supposed to do. This is just the cleanup suction that we're advising to use during the amalgam removal. It's sometimes a pain in the butt to use. It limits your visibility some. Sometimes you can't use it, I'll be honest. If you trim it off a little bit, it fits. If you got a rubber dam clamping away and you trim the bottom off a little bit, it fits better. That's one little trick with that. But it does work. When we were doing our studies, we saw a significant increase when we did not use that and went just to a regular suction tip. Here's another, this is a whole room air filtration that just constantly runs, sitting over there in the corner. I know the Faust company will be here. He has all kind of products. But that just continuously cleans the air all day long. It doesn't make a lot of noise. The big, large auxiliary suctions are very noisy, and you tend to want to cut them off. And you need to leave those things running for at least 5-10 minutes after you get that mercury out of the patient's mouth. So how about for the dentist and team, the barriers we use there? You basically have to use some type of respiratory mask that's going to trap the mercury particulate and the vapor. This one's one that just kind of goes over your face, and the pink and all of those filters are particulate filters and a vapor filter on that mask. You can use a positive pressure mask like Dr. Call uses, where he's got this set up to his, he's either got it set up to his compressor or he's got an big oxygen system in his office. And this is kind of an old picture that doesn't show all of our protection protocols. That's the way he was doing it. Now he's dressed up like all the rest of us. This is Dr. Warwick, and Dr. Warwick has a face shield over looks like a cloth mask, but it's not. That mask has charcoal filters in it. That's probably what we're going to try to get the dental students to use, not too scary looking for their professors. And Dave, what are those masks called? I hadn't fixed this slide. You back there?
Yep, they're called vapor masks.
Okay. All right, and we have those masks. We do sell those masks now at our table. If you check in, you can get some of those masks. At least get those. But make sure you cover with a shield, because you got to block that particulate from getting all over your face and everything. And this is what scared the hell out of everybody when Dr. Young and I did this study, and we came back and said, this is what we need to look like, guys. And we just got crucified, I promise you. Even by our own members, we got crucified. And so some of us dress in these biohazard suits and have these full face masks on. And I tell you, for a guy who had 2 damn heart attacks and gone through chelation twice, that's me. I'm dressing like that. But you don't have to. You can go to those other methods. You just need to use a disposable product over your clothes, or you're going to contaminate your clothes all day long. And I like this one because it protects my shoes and my feet all the way down, whereas the surgical gown stopped about my knee. So I know stuff's got to be falling on my shoes. So you might go wear some booties on your shoes, but try to cover everything up as good as you can. How many people think that looks scary? Let me be honest, it's okay. You're not going to hurt my feelings. I tell you who's not scared by it is your patients. They aren't a bit scared about this. They will come to you for this. And the only problem you have is the claustrophobic patient. Sometimes they are a wreck while we're doing this. So we have some sedations for them, Nucom, nitrous, whatever it takes, talk to them. I've never had one get up and run out of the office and not do it. You have to be patient with some of them and get it done, and take a while to do it. And this is Dr. Young and his setup. I don't know why he didn't cover up his mask. We laugh at him about that, but. And then your bracket table cover. Just cover everything up except what you're using for the amalgam removal. And then those instruments that you use for the amalgam removal, take them out of the operatory and get fresh ones out easily, because you know that bracket table is going to get contaminated. As you lay instruments and everything else, the paper on there is going to be contaminated. You just cover it up, remove that layer, have your other instruments underneath, and they should be clean. And then the mercury post-op rinse, the one I use is N-acetyl cysteine, just a capsule of that, break it open, put it in some water with some vitamin C, a teaspoon of vitamin C. We'll mix that up first time of the day, and then we'll use it all day long. We just make it fresh every morning. Or you can use a charcoal chlorella rinse, which is just nasty looking and messy, but some patients will bring their own charcoal rinses in when they come. And if you've never seen that done, when they do it, their mouth's just totally black from the charcoal. They'll swallow it, and then make sure they don't swallow it after the amalgam removal.
I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. Patients and dentists should make sure that each step of the safe mercury amalgam removal technique, or SMART, will be applied during a dental appointment for filling removal. The first step is for patients to consult with their dentist before the mercury filling removal begins, so that both the patient and dentist agree that all safety measures will be in place. This helps to ensure that the patient and dentist know exactly what to expect. It's also helpful to watch the following example of the safe mercury amalgam removal technique, or SMART, being applied. Each room where mercury fillings are removed should have adequate filtration in place, which requires a high-volume air filtration system such as IQ Air Dental Mercury FlexVac or similar device, capable of removing mercury vapor and amalgam particles generated during the removal of one or more mercury fillings. If possible, windows should be open to reduce the mercury concentration in the air. The patient should be given a slurry of charcoal, chlorella, or similar absorbent to rinse and swallow before the procedure unless the patient declines or there are other contraindications making this clinically inappropriate. Protective gowns and covers for the dentist, dental personnel, and the patient should be in place. All present in the room should be protected because substantial quantities of particles generated during the procedure will elude collection by suction devices. It has been demonstrated that these particles can be spread from the patient's mouth to the patient's knee and to the chest, shoulder, and neck of the dentist and dental assistant. Either a properly sealed respiratory grade mask rated to capture mercury or a positive pressure, properly sealed mask providing air or oxygen should be worn by the dentist and all dental personnel in the room. Non-latex nitrile gloves should be utilized by the dentist and all dental personnel in the room. Face shields and hair head coverings are to be utilized by the dentist and all dental personnel in the room. In order to protect the patient's skin and clothing, a full-body impermeable barrier should be utilized. External air or oxygen delivered via a nasal mask for the patient also should be utilized to assure the patient does not inhale any mercury vapor or amalgam particulate during the procedure. A nasal cannula is an acceptable alternative for this purpose as long as the patient's nose is completely covered with an impermeable barrier. A saliva ejector should be placed under the dental dam to reduce mercury exposure to the patient. A dental dam that is made with non-latex nitrile material should be placed and properly sealed in the patient's mouth, as well as a full head, face, and neck barrier that is under and around the dam. During amalgam filling removal, the dentist should utilize an IQ Air Dental Mercury FlexVac or similar device in close proximity to the operating field, that is 2 to 4 inches from the patient's mouth, to mitigate mercury exposure. High-speed evacuation produces better capture when fitted with a cleanup device, which is preferred. Copious amounts of water to reduce heat and a conventional high-speed evacuation device to capture mercury discharges should be used to reduce ambient mercury levels. The amalgam should be sectioned into chunks and removed in as large of pieces as possible using a small diameter carbide drill. Once the removal process is complete, the patient's mouth should be thoroughly flushed with water and then rinsed out with a slurry of charcoal, chlorella, or similar absorbent. During the opening and maintenance of suction traps in operatories or on the main suction unit, dental staff should utilize the appropriate personal protection equipment described earlier. An amalgam separator should be properly installed, utilized, and maintained to collect mercury amalgam waste so that it is not released into the effluent from the dental office. Dentists must comply with federal, state, and local regulations addressing the proper handling, cleaning, and or disposal of mercury-contaminated components, clothing, equipment, surfaces of the room, and flooring in the dental office. I hope that you'll make the smart choice about your dental care by asking for safety measures during your mercury filling removal. For more information about the Safe Mercury Amalgam Removal Technique, or SMART, including scientific research about why these safety measures are important, visit thesmartchoice.com from the International Academy of Oral Medicine and Toxicology.
All right, so those contaminated barriers, I use Stericycle. It's a 5-gallon bucket. They go in there. That's the gloves, the rubber dams, those kind of smaller barriers, the mercury traps, stericidal traps, they all go in there. That other stuff creates a lot of bulk, and we do have a problem with that, which we haven't solved, because it creates so much bulk, it would cost you a fortune. You'd fill up a 5-gallon bucket, you could do it in a day, and those 5-gallon buckets are $500. So currently, they're going in the trash outside, but don't store them in the office. You don't put them in plastic bags and leave them in the office. Get them outside and get them out of your office. And this is a problem we haven't solved. So you can rent a mercury vapor analyzer to test your environment from the IAOMT. We have a program. If you're interested in that, just stop by our table. If you got carpet in your operatories, if you got fabric on your chairs in the operatory, like you got extra chairs in there, if you got curtains, they're probably contaminated. And you just need to have hard surfaces in there that can be wiped and cleaned. And if it is contaminated, you can decontaminate it with some of those Mercon products, or you can make flowers of sulfur to decontaminate surfaces. And if you got carpet, you just got to get rid of it. You got to replace it. And make sure you don't have any amalgam hanging around. You're going to hear Dr. Kennedy this afternoon tell you about fluoride and just give you some facts about fluoride to just blow your mind. We want you to become fluoride-free as a member of this academy. I'm telling you, it might cost you a little income, but you'll make up for it by the new patients you attract. And we'd like you to try to use fluoride-free composites and BPA-free composites. And Admira Fusion is a BPA-free composite. I've been using it for over a year now, since it first came out, and it's a great composite. Really good. So what are we asking you to do as a member of this academy? We created SMART so that you could become a new member and very quickly identify yourself as a dentist willing to protect your patients. We didn't have a next level. It's called accreditation. Accreditation involves what's in SMART, but it involves more study, more learning about the scientific data, and prove you have a good knowledge of the science that creates SMART. So that'd be accreditation, which is less. This course is one thing required for accreditation. So if you're here and you had to come to 2 meetings, and then you can apply for the accreditation process, but we don't want you to have to wait 2 meetings, which might take you a year or 2 to get, before you can raise your hand to the public and say, I'm willing to do this for my patients. So that's what the SMART program is. It's inexpensive. We do charge, we charge $50 a year, and I don't know what we charged initially. I don't even remember. I should. I'm the treasurer, but I don't. I think it's $50, but I'm not sure. So it's real easy to get this. You just have to go buy the equipment you need. You have to have the separator. You have to have the auxiliary suction unit. We'd like you to have something cleaning the room and the air all day, those kind of things. So this is some social media stuff, okay? From start to finish, everyone I had contact with was kind, friendly, and compassionate. Dr. DeGroyer has a wealth of knowledge. She explained things very clearly and was very open to my questions and concerns. Having the amalgam in my mouth removed will be a very pricey process, but I am certain that she will take all the safety measures that she is able to take. As my health is of concern, I truly feel that a patient's health and well-being is her number one concern. I've been to the Pittsburgh Center for Holistic Dentistry a couple times now, and I'm very impressed with the commitment to excellence and the information provided. The staff are knowledgeable, professional, and kind. I will feel confident that the safest procedures will be followed to remove the amalgam fillings and restore my mouth with material that is non-irritating to my system. And one more, I appreciate having a dentist who knows how to get the mercury out of my mouth and takes the proper precautions to assure my exposure is minimum. I wish all dentists cared enough to make this change. Thanks for taking care of me. Now, when a patient goes and an IAOMT member doesn't use a rubber dam, doesn't cover them up, doesn't protect them, you get bad post. I didn't put the bad post up. I don't want you to have bad post. Okay? So, get off my soapbox. How about some questions? You going to save them for later?
Test, Dave.
We got a couple minutes. We'll do some questions.
Test. Actually, it's lunch in 2 minutes,
Well,
so we really don't have time.
2 minutes for questions.
Like one question, maybe?
Maybe.
Anybody have one really good question?
Okay.
All right, it better be good. Wait.
I always have patients ask me how many fillings can you remove at a time. So what I usually do is, like, through my own protocol, is to do a maximum of 2 per quadrant. So what do you do in your practice?
All right, so each patient's different. You got a patient who's sick, weak, fatigued, being treated for cancer, maybe on their last legs, they're desperate, they want their amalgam out, go slow. You get somebody who looks pretty healthy, doesn't really have a lot of complaints, but they want those things out of their mouth, sit them down and get them all out. So it just depends on the patient. Okay?
But if you use this protocol, it really shouldn't matter as far as I'm concerned.
True. That's what we hope. Yeah.
We got like 30 seconds. Can you scream it loud?
Okay. Well, that's a Huggins philosophy, and when you get them all out, you cross the midline. I mean, all of them.
You have studies on SMART showing that you remove everything.
Yeah, all that's part of what's on SMART. We got the website. Those videos are available. You can go to our website, and you'll get linked to them. We have a mentor program. This is not easy sometimes to implement. We have a mentor program. If you go by our booth tomorrow, if you want to have a mentor, sign up. We'll match you with somebody which will help you do this. Okay? There's a young lady here, Frances Herning, that's willing to come to your office and help you do this. You'll work out a financial deal with her. I think she's in the back of the room. No, she's gone.
Okay, guys, lunch is you go out here, walk toward the casino. You'll see a little sign before you get there saying turn right.
Go upstairs.
We'll see you right after.